Around this time last year, uh, work was completely different. It was a happier time. It was almost Christmas, the ones that have to work on Christmas Day, we work together. We usually have a little potluck together, but things have definitely changed over some time.
This time last year, my job in the ICU was fairly predictable. We had our very good routine to our day, and we felt very confident about our abilities to manage the severity and the number of patients that would need our services each and every day.
I think that my job comes with a lot of excitement pre-COVID and during COVID. But my job description essentially is to care for patients who are really critically ill and oftentimes minutes or hours away from dying if no intervention takes place.
My job last year involved just kind of day-to-day EMS 911 calls. A little bit of interfacility transfers. A wide variety of calls here in Regina. Traumatic calls or illnesses or sick people. But it was pretty routine. It's kind of what I was used to for the last, almost 10 years. And it just kind of every day was a little bit different, but it was easy.
Well, before the pandemic, I was a brand new nurse in the ICU. I actually just finished my course. We were preparing for influenza season of all things. It was Christmas time. We were starting to slow down. Elective surgeries were slowing down. You know, it was what you always saw every day. Not that it's great to see every day, but what our normal is in the ICU, people coming in post surgery that and it didn't go optimistically or, are just our day to day, and just starting to clear out and kind of hunkering down for like the 2 week slowdown, vastly different than what it is this year.
The services that we provide in the intensive care unit really focus on providing life support to people who are at critical risk of either dying or having significant injury from a result of their illness. That's been the same before the pandemic, during the pandemic, and I anticipate it'll be the same going forward. The difference is that it's the number of people who are sick, how sick they are, and for how long they are so sick.
I'd come in on the shift, I would get bedside report and go in and assess my patients, do my charting, go around and help out my other coworkers and check on other patients with them. And it's a good time for me to communicate with my coworkers, see how they're doing, and it's like going to work was really fun most of the time, depending on who you worked with that day.
We were dealing with conditions like COPD or heart failure or diabetes or sepsis or infections or liver failure or kidney failure, any of these things where these conditions existed for 20 years, 50 years, 100 years. And our knowledge about these diseases also went back to sometimes 200, 300 years. Of course, our knowledge improved with time.
So we're an extension of kind of the emergency room. We basically bring the emergency room to you. The skills of my partner and I were able to basically provide you with advanced life support in your home or in our ambulance, which would equate to about the first 30 minutes at the emergency room. So whether that be any sort of anything from simple fractures or burns to very extensive injuries or illnesses, we're able to treat them pretty quickly and pretty rapidly right in the ambulance.
What's completely different is the barriers and the risks and the extra steps that we have to take to keep ourselves safe and to do our part to make sure that the infection doesn't spread and that we're not spreading it to other patients or their families.
Now we're dealing with a disease in the hospital where you learn as you go and you readjust your focus as you go because things do change and new studies come up and erase some of the things. So I have to say that my job before COVID and my job during COVID has looked like two different jobs.
So a normal day, we start by checking our temperature and donning a mask as soon as we enter the building. We ensure that we are not running a fever. We also go through our pre-COVID screening, which asks just general questions about our health, and what kind of, if we've had any exposures in the last 14 days. And then, yeah, masks are donned and worn throughout the entire shift, whether that be in, the change rooms to lunch areas to everything. The only time we really take off our masks is when we're actually physically eating or drinking.
I get up, I go to work, I blast my music on the way to work, try to get into a good mood.
I think that describing a normal day for me now seems ironic because I don't think we have normal days anymore.
Well, a normal day for me now is both completely the same and completely different.
I feel like now compared to before this pandemic even actually happened is I get up earlier for work so I can kind of like mentally prepare myself to know what I'm going to walk into when I get to work.
I oftentimes wake up really early, maybe around 5 o'clock or so, and sometimes I do a lot of interviews with different TV channels or radio stations, or even prepare my own write-ups and my own videos and my own status updates really early in the morning over a cup of coffee, which is something I never used to do. This is not what I am trained or accustomed to do.
The calls definitely take a little bit longer. So now, a 911 call, we have to don our PPE. So we'll often put on gowns and gloves and goggles and face masks and everything else before we enter into the patient's home. It definitely creates a little bit of, seems like lack of urgency, but it is still urgent and we're still acting quickly to get that stuff on. But I also start my day by giving the ambulance a quick kind of clean to ensure that it is clean to start the shift. And then after every single call, we are wiping every surface down. And so, yeah, definitely a lot more diligent in our cleaning and taking more time, I guess, in between every patient to ensure that our ambulance is ready for the next one.
You get to work now and we're, not where we used to be, and it's busy and it's chaotic, and you're wondering, well, how many patients are we going to have today? How many COVID positive patients do we have today? Are we doubled? What new work standards are going to be in place today? What new policies?
Now, when you get into the hospital, it's mandatory masks when you get in. So you have your staff entrance that staff are specifically to go through just so we aren't, crossing paths with visitors coming to see their loved ones.
The moment you get to the entrance of the hospital, you realize how much life is different. You have to show your ID. I can't enter the hospital even if everyone knows who I am without my ID. I have to wash my hand. I have to put my mask. I have to be careful going in the elevator. So even before I get to the ICU, my mind is already on alert. Things are different. Be careful. Watch out. Distance yourself. Even if I'm walking with a colleague, there's a bit of a different distance between us.
How is our infection control with patients changed today? Because we are treating everyone right now, at least in the ICUs, as we're treating everyone as COVID positive.
It definitely creates some stress, especially on those high acuity calls where families watching you as you pull in front of their house, they're watching you put on your PPE as quickly as you possibly can. But, we have to ensure that we remain safe so that we can go to the next patient.
I feel like what's different now, and it's kind of just like, don't want to say it's a nuisance, but it's definitely very important, is that we're all dressing in PPE for every single room that we go in, regardless if they have COVID or not, because we want to decrease the chances of any spread or transmission to any of our other ICU patients.
This is one of the things that are really common. People think, well, there's only so and so number of patients in the ICU. But what many people may not realize is that we treat a lot of patients as if they have COVID until it's proven otherwise. Because if we don't treat them that way, then we might infect the whole hospital. So many times people who come with respiratory symptoms or symptoms suggestive of COVID, we treat them that way. So I may have 4 patients with COVID confirmed, but I may have 8 patients or 9 patients or 11 patients that I'm treating as if they have COVID until proven otherwise. And so the work becomes a lot more stressful. Whenever you put on and you take off your PPE, you're trying to be really careful because You know, you don't want to infect your colleagues, you don't want to infect your next patient. And those are stressful moments. You know, I really, really want to make sure that, you know, I am not the one moving this disease away to other people.
So you're just wondering, is this the day that I'm going to be exposed? Is this the day that we're going to run out of PPE? And that happens kind of as soon as you get into the hospital.
We used to have a patient limit of about like 10 beds on my unit. However, we do have 12, and sometimes there's cases where we flex to 11 beds, and we usually save one of the beds for medical ICU if there's a code blue. Because there's times when medical ICU is full, they'll use this bed.
We're getting pretty good at putting it on pretty quickly, and we kind of have a system now where one of us will get it on and enter in the home while the other one kind of continues to put their stuff on. And that way we can at least kind of stop that clock and get in there and at least provide some care and just some reassurance to that family that we are in fact going to care for your loved one.
All of the worst things that you're just kind of waiting and preparing to have happen, you're wondering every day if that's what's going to happen.
I don't get the same sense of joy or accomplishment from having that relationship with the patient and their family because we're wearing PPE, because we have barriers, because we have boundaries and limits on how close we're able to spend and how much time we're able to be with our patients. And that's what's completely different.
And now you walk around and you see all these sick people and there are nobody next to them. I find that very distressing to me and distressing every day I walk into work. And so there's all these added stresses at work and difficult things that's never been there before.
And then you go home and you try to forget about work and you're just mentally exhausted when you get home. Your husband can't give you a hug, your kid can't give you a hug, your dogs can't come to meet you. You strip either in your like front entry or in your garage if you have a attached garage, and you like run to the shower, try to scrub off anything that's on you, because your biggest fear when you get home is having something on you and giving it to your family.